It's my honor to open the session for Water and Global Health Crises. One might not think the honor is to talk about crises, right? But the most honor right here is that we have so many people in the audience who have come to join us that will make a significant difference in the world in regards to water and health. So I would like to start right away. You'll see actually that the panel does not look like probably what's on your program. Nikhil was called away, the director of UN Water, 2 days ago. So we are lucky today to have two replacements for him, not only one. So I would like to introduce first our first speaker, who is Dr. Kellogg Schwab, who is the director of the Center of Water and Health at Johns Hopkins University. Dr. Schwab.
Thank you. It's a pleasure being here today, and thank you for this opportunity to start off these sessions. And what I'm going to do today is talk a little bit about some of the needs with respect to evidence-based approaches to provide water and sanitation throughout the world. And what we know is that water is at the nexus for 21st century challenges, not only in energy and food, but as we have heard about earlier today, in health, with disasters around the world causing problems, and also instability for countries and even regions around the world. And we know that global climate change will have unpredictable but potentially devastating consequences for the hydrological cycle. And that changes in the total amount of precipitation will occur in annual and seasonal distribution and onset of snowmelt. And that increasing frequency and severity of floods and droughts, which causes a loss of reliability of existing water supply reservoirs. And I'd also attest to you this is not just low-income countries. This is in high-income countries as well. In the United States, Atlanta, Georgia's water supply almost ran down to 0 days left during the drought of last year. So conflicts within countries is also a major concern. We also know that water rights are vigorously defended by the privileged users, and agriculture and manufacturing use the greatest share of the world's water, with irrigation count up to over 70% of the water uses in many regions of the world. And the scarcity of water is also an economic issue. Water has an economic value in all its competing uses, and should be recognized as an economic good. I personally believe that water is an inalienable right for every individual on this earth. However, part of the value of water is reflected in the cost of extraction and delivery to users. And there's debate regarding if users should pay for these costs to ensure accountability and financial stability, and also the ability to have this be sustained beyond just the few years that an intervention puts in place. We would like for stability to occur for decades as we try to improve the quality of water and sanitation around the world. With that, I'd like to tell you a little bit about the Global Water Program at Johns Hopkins, which brings together not only the disciplines of public health and engineering, which is the strong influence that has been historically driving this, but we've also incorporated colleagues from behavior and the Centers for Communication Programs, policy from the School for Advanced International Studies, economics from arts and sciences, and science and technology from applied physics laboratories. So we have a toolbox of all these disciplines working together to address the water needs. And the idea here, again, is to start from the beginning with an understanding on the behavior and policy side with economics before even approaching the engineering questions and the public health needs that we realize and we've heard about earlier today. So potable water, so drinking water and sanitation are intimately linked. If you cannot remove waste, it is very challenging to be able to provide high-quality potable water throughout a period of a year and decades. So these are linked together intimately. We also know that agriculture, industry, and municipalities compete for a finite resource. And the global needs for water resources and infrastructure exceed capacity. We also have the advantage now of realizing that there's what we define as leapfrogging technology. This is what we define as decentralized infrastructure with real-time telemetry, called the cell phone phenomenon. In the world now, anywhere you go, there are cell phones. They are not connected with wires. They're connected by individual satellite towers that transmit the information to the cells. we propose that water and wastewater infrastructure could be considered that as well, a decentralized location for providing high-quality water and waste removal, not relying on the hundreds of thousands of miles of pipes in a region that are very challenging to put together and to maintain. Also important to note is that there's improved technology, defined as nanotechnology and biomedical devices, that can be put in place, very sophisticated in developing them in the laboratory in these places, but very simple to use. The goal is to increase the simplicity of whatever we're trying to achieve to make it user-friendly from the beginning. What is so critical is that appropriate behavior and business models be implemented from the beginning, not as an afterthought, and that you understand what the population wants before going in there and realizing that there are economic models and values to this as well. So what do we take for granted in the United States? We take for granted we can go to any city, take a long, cool drink from a water fountain, and be reasonably assured we're not going to die in 2 days. Those of you this morning that brushed your teeth here in New York City and around the United States probably brushed your teeth with tap water and didn't give it a second's thought. Many areas of the world you would not do that. We expect also that we can wake up in the middle of the night, take a few steps, and urinate and defecate into a toilet, flush the toilet, and it's out of sight, out of mind. Truly an amazing capability we have here in high-income countries that is totally taken for granted. And the cost of this is fractions of a penny per liter to be coming into our homes 24 hours a day, 7 days a week, 365 days out of the year. Many areas of the world, that's not the case. Outside of Lima, Peru, this is a household of 7 individuals, and their water supply is stored in these open buckets. This is their waste removal system here. It does have a nice view, but the urine and feces builds up in this and flows down into their compound. They are not connected to any sort of pipe system or waste removal. There are 1 million people living outside of Lima, Peru. There's hundreds of millions of people around the world that live in these conditions. As we've heard before, 1.5 million children die from diarrheal diseases. This is every 15 seconds. It's greater than AIDS, malaria, and measles combined. It's estimated more than half the hospital patients suffer from water-related diseases. And improved water access and sanitation can dramatically decrease this burden. We know that. However, we also understand that there's a complexity to that. What are the basic needs for an individual? It's bounced around for drinking, sanitation, bathing, and cooking. It's estimated anywhere from 50 liters to 100 liters. You can live on much less. But if you want a sustainable society that is able to use the water for washing and cooking, it's approximately 50 to 100 liters. In Africa, women and children spend 40 billion person hours a year hauling water. This woman is carrying 30 liters on her head, 30 kilograms, 66 pounds. She's going to walk about 3 kilometers. This child has a permanently deformed neck from carrying too much water on her head. Every day they carry water. The source water is this cloudy, turbid river for their drinking. This child